Good morning, everybody from Sancheti Hospital and Helios. I am handing over this session to Dr. Saurabh.
Thank you so much, Rahul. Hello and welcome to today's webinar on importance of pulmonary rehabilitation in COVID patients and a live physiotherapy session with a home quarantine COVID patient. So now, when we all are well aware of what COVID is and how it impacts and what symptoms it shows, still there is very less awareness of what physiotherapy and how pulmonary rehabilitation plays a role in managing COVID symptoms and preventing long-term repercussions of COVID-19 on your respiratory systems. And for that, for enlightening us today on the importance of COVID rehabilitation, we have with us Dr. Razia Nagarwala, who is a professor and head of the cardiorespiratory department of physiotherapy at Sancheti Healthcare Academy. She will be walking us through the importance of pulmonary rehabilitation in post-COVID management. Razia ma'am, over to you. Thank you so much for joining us today.
Thank you, Dr. Saurabh, for kind words. And a very good morning and happy Dussehra to everyone. So I'll just share my screen. Okay, is it visible?
Yes, it is visible.
Yeah.
You can go ahead.
So today, as we are going to speak about the COVID rehabilitation. Now, what mainly I'm going to cover is post-COVID rehabilitation, means the patient who have already recovered. And not only that, the patients who are still home quarantine or in isolation, they can also work on the same thing. So I'm not going much into the COVID-19 pathophysiology and all, because by now everyone is well educated about all these things. As we say that coronavirus is not new. It was there. It was there something around back 50 years back, where it started as a Middle East respiratory system syndrome. And then in 2003, it was SARS, which was there. And then now in 2019, we got this new coronavirus. And this is what it caused, was named COVID-19. And this started from Wuhan, China, from the seafood market, and then it transmitted to human and it became a pandemic. So how it affects finally? Once this coronavirus, when it enters into the host cell, that is in the human body, it gets attached to the ACE2 receptors. And these ACE2 receptors are very rich in our lungs. And that's why mainly we see that it affects the lungs. And then once it attaches, it goes into the host cell. It starts multiplying and cause the destruction of the alveoli. The alveoli are your gaseous exchange unit in the lungs, and that's why the oxygenation goes down. And thus the destruction happens, what is named as pneumonitis. And then it starts spreading. It may not only stay there on the lungs, but it may also, like when I say ACE2 receptors, they are also present in kidney and other epithelial cells, so in the blood vessels, and the muscles. So sometimes it can happen that it's not only the lungs which are getting affected, but maybe the kidney also is getting affected, and that's caused increase in the creatinine, the heart, that cause myocarditis, and sometimes your blood vessels getting affected, causing thromboembolism or bleeding disorders. Hence, this is what we see usually. The picture in the X-ray view is in the COVID-19 patients, where the lungs are getting affected, causing the pneumonitis with the destructions of the alveoli. And when it heals with the fibrosis, and thus it causes the destruction of the lungs. And that's why it may persist, leaving the dyspnea and the low oxygen level. Fortunately, yes, the cases have reduced. When we say the COVID-19, you see mild to the severe cases, but yeah, the death rate is less, and we are the one fortunate in India that the death rate was very less in India. And as per today's statistics, if you see, the recovery rate is very high, but the death rate is very, very low. Hence, we don't need to worry. But yes, one has to work on the exercise part and getting the rehabilitation and going back into the community. So the question is being asymptomatic okay? Yeah, we have many patients or many people who are not showing any symptoms, but then they are tested COVID positive. As we say, always the precaution is better, and hence the absence of symptoms does not imply the absence of harm. So one has to look at the systems, their progress, how they are feeling, and they have to take a precautions, maybe a multivitamins to boost their immunity, and of course the physical exercise, because exercise improves your immunity. Hence we are emphasizing on exercising. So what is rehabilitation? A rehabilitation is a set of intervention designed to reduce disability which comes because of the COVID-19 manifestation to your different systems and optimize the functioning in individuals with health conditions in the interaction with their environment. So the aim of rehabilitation is not only to reduce the disability which is caused by the COVID-19, but to improve their functions and take them back to their normal lifestyle. So how does this COVID-19 affect? As I say, it doesn't only affect your respiratory system, but it may affect your other organs of the body also. So when it affects your lungs, what are the symptoms will be the cough, breathlessness, and hypoxemia. Hypoxemia is nothing but less oxygen in your blood, and that is why we always check with the pulse oximetry, which is going to tell you about your SpO2, that is the oxygen saturation in the blood with a hemoglobin. Musculoskeletal system, it may cause myalgia, that is pain in the muscles, fatigue, and muscle weakness. Now, this muscle weakness is more seen in the patients who are, who have been in a long term in the intensive care unit, and that is known as ICU acquired weakness. So in them, this will be more pronounced. Neurologically, it may cause neuropathy. That is, again, it's going to cause the weakness of the muscle because the nervous system affection. Psychological impact is also very high, causing anxiety, depression, and post-traumatic stress. Now, this is also one has to tackle by remaining, by causing the positiveness. Why? Because see, the patient may have an isolation, and that itself causes lots of anxiety and depression. And when the other members of the families are affected, that is again another cause of the depression and anxiety. Look for the other cardiovascular systems and the renal system also, because as we say that COVID-19 are known to affect the cardiac system, also causing myocarditis and all. So when you start with a rehabilitation or start the exercise program, it's very important that you get the screening done by your physician and get the green signal, or the one who is treating the patient should look for this red flag. That means the patient SpO2, it should not be less than 90%. Tachycardia, that is increase in the heart rate, arrhythmias, the rhythm of the heart, tachypnea, that is increase in the respiratory rate, confusion and altered sensorium, that tells you mainly about your central nervous system, and thromboembolism, that is a bleeding disorders. So one has to screen for these red flags before we start with our exercise program to the patient. Now, just to look at this thing, how this goes into a vicious circle, that there is a decrease in the oxygen level, which cause dyspnea or breathlessness. Hence, the patient does not work physically, which decrease the exercise capacity, leading to deconditioning. And all this lead to fatigue. Hence, we have to break this cycle. So before we start with the exercise program, a quick assessment should be done where you check the blood pressure, pulse, respiratory rate, oxygen saturation with a pulse oximeter. What happens here sometimes that maybe a person may have a oxygen saturation normal at race, but with physical activity it decreases, and that's why we have to look at the exertional dyspnea also, or exertional decrease in the SpO2. Also SpO2 in supine lying and sitting. So check it with whether it changes with the position. Observe how the person is talking. What are the facial expression of any showing any expression of discomfort, ease of changing the position, and how the person is doing the physical activity, and gait for checking their balance and unsteadiness, because as I just told you that it may affect the nervous system. Hence you want to rule out and then plan out the exercise program accordingly. Continuing with the assessment is muscle system. Check the muscle power, the strength of the muscle, maybe by just using the manual resistance or using the handheld dynamometer. Functional capacity, that is the aerobic capacity also, by doing either a simple 2-minute step test or a 2 minutes or 6-minute walk test, and check how much distance patient covers. And with this, again, I emphasize they check pre and post SpO2, whether the SpO2 remains same or does it decreases. Cognition level by using the simple mini mental score or any other method, and health related quality of life using the SF12 or 36. Different outcome measures we can use to check the patient's functional status. How are the patient doing their activities? So there are certain tests which we do. These are very quick tests without taking much time. 5 times sit to stand test, or ask the person to do the sit to stand test for 30 seconds. When the person is doing 5 times sit to stand test, see in how much time the person completes this test. Usually it takes 5 seconds. Or in a 30 second, how many times person can do sit to stand test. This only not checks the aerobic capacity, but it checks the lower limb muscle strength. Then check a time, or you may do a time up and go test, a very quick test, where you ask the person to sit on the chair, and with the go, person walks 3 meters and come back and sit on the chair. Usually, normally, it should not take more than 10 seconds for the healthy individual. This is how it is performed, where person walks, stay 3 meters and comes back. And then you check for the dynamic gait index to see the speed of walking of a person and how are their balance. Goals for physiotherapy will be to reduce symptoms of dyspnea, fatigue, improve the muscle strength, facilitate the functional recovery, and improve the exercise tolerance. So how we achieve this all? By a good pulmonary rehabilitation. Now, what is a pulmonary rehabilitation? As I say, the lungs are affected and we want to improve the lungs, how much the person can breathe in, and that's at the same time you want to improve the saturation of oxygen, and that is SpO2. And this we will achieve by doing a good deep breathing exercise. And if the person is dyspneic, breathless, one can teach them the breath control, that is relaxation and breath control. So, of course, Dr. Saurabh is going to demonstrate the breathing exercise where we ask the person to take a deep inhalation using the stomach and breathe in, take a little bit hold for 1 or 2 counts and then breathe out. At the same time, we can do the deep breathing exercise using the upper limb. That is, a person breathe in while taking the hands up and breathe out while taking the hands down. So this will only help not only in the breathing, but also improving the upper limb activities. Pacing of activities, especially this is useful for the patients who are breathless. You have to tell them to take a good rest in between the exercise or during the day, or when they are doing activities. They should not keep doing activities till they become breathless. Do activities, take a rest, and pause, and then again continue with the exercise or their activities of daily living. We can use certain instruments to improve the breathing exercise. These are very simple instruments which we use. They are called incentive spirometer. You must have seen, either you have a 3 ball or you have a 1 ball where you target the volume and ask the person to take a deep breath in, where the ball will go up. And this is going to give a good feedback to the patients and improve the breathing exercise and thus the lung volume. Another simple thing which we use is the inspiratory muscle training. As we exercise our other extremity to improve the strength by using the weight, this device is used for improving the inspiratory muscle strength, because you want to improve the endurance also. And this is what it is going to help. This is simple one which has a spring inside. It is spring loaded, and you load the spring, and the person is supposed to breathe in through this resistance, and this will improve the respiratory muscle strength. If the patient is feeling breathless or dyspnea, we have a different dyspnea relieving position. One person can take this at home or anywhere. A simple high side lying, that means you take 3-4 pillows and go on your side line, which will help you in relieving your dyspnea. Or when you are sitting on a high stool, you can again go down on your hands with a piles of pillows. You don't have pillows, just put yourself on the desk and lean forward. Or you are standing, you are working in the kitchen, or maybe you are working anywhere, or you are out and you are feeling breathless, just take any support and lean forward. This will help you in relieving your dyspnea. If the person has secretion, that is a cough, one can use the secretion removal technique, that is active cycle of breathing technique and autogenic drainage. These are the technique which helps in the removing of the cough out of the lungs and clearing up the lungs. Again, we can have different devices which will help in this secretion removal. These are a cappella or a flutter. These have a vibrating ball inside, and plus it creates a positive pressure inside, creating vibration, which helps in the mobilizing the secretion upwards and help the patient to cough it out from the lungs. So another thing, most important thing, those who are having low oxygenation, where the SpO2 showing low, it is already found that taking up the prone lying position will help them in improving their oxygen level. And of course, the behavior modification in the terms of motivation towards their exercise, towards the life, to spread the positiveness, what we call be positive. Other thing is to improve the muscle reconditioning, which Dr. Saurabh will be showing direct demonstration, where you make the person do the active exercise for the lower limb, for the upper limb, and for all the body, that is for the spine also. Use certain resistance. Maybe you can use the free weights, or you can use the TheraBand, the elastic band, to improve the muscle strength in a later stage. Aerobic reconditioning, by doing lots of aerobic exercise depending of the person's ability to do. As we say, we will assess first what is the capacity of a person to do, and accordingly that we will be planning out their exercise program. Progress aerobic exercise, you can start from 5 to 10 minutes and reach 20 to 30 minutes depending upon the capacity of the person. Walking, the best exercise. If the person has a static cycle, can use the static cycle. Not only will help in aerobic conditioning, but also improving the lower limb strength. Functional training, that is, you want to improve the patients, as I say, this sit to stand will help them in improving their lower limb strength, balance, which we have to work on them. So improve the balance by doing more of your balance exercise with them. Another thing we cannot forget this depression, anxiety, and for that even a dance and music therapy is the one of the answer, because this not only improves their movement but also will reduce the anxiety and depression. The movement and dance to support the intellectual, emotional, and motor functioning of the body. And the last and not the least, to practice the meditation, because you need to support your mind by relaxing the body, and that's how shavasana and meditation will help. Thank you very much, and I will hand over it to Dr. Saurabh.
Thank you so much, Razia ma'am. It was very insightful, and all the physios that are watching is that they have also learned a lot about how the assessment should be done, what all red flags should be assessed before starting with the treatment. And for all the patients and relatives and general public watching us, they will also understand much better why pulmonary rehabilitation is important and why respiratory strengthening as well as maintaining a physical activity, a moderate physical activity is important for them to recover completely from all the effects of COVID-19. So thank you so much, ma'am, once again for joining us on a Sunday morning and giving us your valuable time.
Thank you, Saurabh. Thank you very much.
Thank you so much. And for now, for the next segment of our today's live, we're going to invite Ajay Menon, who has been suffering, who got infected with COVID and started showing symptoms a week back. And since then, he has been home quarantined. So we are going to demonstrate live exercises where he will be doing the physiotherapy, respiratory strengthening, and overall exercise session with him. So thank you so much, Ajay, for agreeing to join us today.
Thank you, Dr. Sir, for having me here today.
So before starting, just to make our viewers understand, can you just tell us a brief about how did it happen? What were your early symptoms, and when did you get tested positive, and what did you do after that?
Sure. So this was last weekend when I was experiencing quite a bit of body ache. I had a little bit of temperature at about 100, 101, and my throat also was hurting quite bad. It was feeling very sore. That's when I realized that, it didn't seem like the normal flu. Could have been the normal flu, but I thought it was better to get myself tested. So I underwent the RT-PCR, the swab test, and it came out to be positive.
Right. And then after that, you decided to be home quarantined because the severity of the symptoms wasn't as much.
Exactly. So the prescribed duration for quarantine is 14 straight days.
Right.
You're staying in a separate room, separate to the entire family, and taking care of yourself.
Right. That's very true. To all of you, was the reason why we are doing this a live physiotherapy session, because first thing that comes to, we have been interacting with a lot of COVID patients, and first thing that comes to any patient's mind after we talk to them about exercising, I'm already so fatigued, I'm already so tired. How will I be able to do the exercises? Will these exercises be too tough? Will they tire me out even more? And that's the reason why we wanted to get Ajay along and make sure he is doing the exercises, and all of you can see how these exercises help in the longer run. And they are very basic exercises which are not going to put any strain over your body and over your lungs. So should we begin?
Yes.
So before starting, what I wanted to do is just check your O2 saturation, because that is a very important parameter that we are going to check. So whenever, for all the viewers that are watching us right now, whenever you're doing exercises while being COVID positive, is that you need to keep checking your O2 saturation often enough. And whenever while exercising, if your O2 saturation drops by more than 3%, you should be taking a 60 seconds or a 90 seconds break in between, and then you can continue with the exercises. So can you just show us how much is the O2 saturation right now?
98.
98. Perfect.
Yes.
All right. You can remove the oximeter. So before starting, just take a few normal breaths. Inhale and exhale. So in the first part of the exercises, we are going to focus on your lungs and doing the lot of respiratory and breathing exercises. The technique that we are going to use throughout this session for inhalation and exhalation is called as pursed lip breathing. So what you're going to do is inhale deeply through your nose, then make a O of your lips and blow out. So a simple way to understand this is basically smell the roses and blow the candles. That's how you explain it. Perfect. Now we're going to add a 3-second hold and see how you're tolerating it. So inhale deeply. I'm going to count till 3. You're going to hold your breath. Perfect. 1, 2, 3. Breathe out. One more time. 1, 2, 3. Out. So as we can see, Ajay is very well able to tolerate a 3-second hold. So we're going to progress to a 5-second hold and see how he is doing. Breathe in. 1, 2, 3, 4, 5. Breathe out. Breathe in. Breathe out. I'm so sorry. Once again, breathe in. 1, 2, 3, 4, 5. Breathe out. One last time. 1, 2, 3, 4, 5. Breathe out. Perfect. So all the exercises that we're going to demonstrate today, you should be doing at least 3 to 5 repetitions of each exercise. Are you feeling comfortable so far?
Yes, absolutely comfortable.
Or when to take a break or when to stop exercises is whenever you feel shortness of breath, heaviness in breathing, a slight lightheadedness. So any of these symptoms, if they show up during the exercises, you should be informing your physio who's taking the exercise, or if you're doing them on your own, just take a 60 to 90 seconds break till the time your breathing normalizes. Next set, what we are going to do is are called as thoracic expansion exercises. So basically, our thoracic cavity, we need to expand our thoracic cavity, which allows our lungs to expand and our diaphragm to depress as much as possible. So idea behind all the respiratory exercises is that your tidal volume of your lung should be increased. So amount of air your lungs can hold in one single breath. That's why whenever you're doing the breathing while doing the exercises, it has to be deep inhalation, as much as air as you can take in, and exhale out as much as air as you can, right? So in first thoracic expansion exercises, you're going to keep your hands straight and then slowly lift them up. While lifting them up, you're going to inhale, breathe in through your nose. So this has to be as slow as you can, and keep inhaling till the time your hands reach, and go back a bit. So that gives a slight bit of stretch over your chest area. And down. Perfect. One more time. And down. Very good. All right. Now the same thing we are going to do sideways. So you're going to keep your hands by the side of your body. You're going to lift them up all the way up and all the way down. As earlier, when you're lifting them up, inhale, and while bringing them down, exhale. Perfect. Right now, Ajay has some restriction on a left side, because of which he's not able to keep his elbow straight. But when you are doing it, make sure your elbows are completely straight. One more time. And down. Okay, perfect. Next part of thoracic expansion, we're going to try and stretch the upper muscles of your thoracic region. You're going to keep your hand like this, and then you're going to take it back all the way and feel the stretch on your pectoral muscles and the upper part of your thoracic cage. So you're going to inhale while taking it back and exhale while bringing it Back together. Perfect. Deep inhalation and very good. One more time. Inhale deeply. Perfect. Very good. Now, we're just going to take a 30 seconds break. Are you feeling comfortable so far?
Yes, Dr. Saurabh.
All right. So, like these 20 to 30 seconds break in between are important. It just allows your lungs to recover in case there is slight breathlessness that you are experiencing. Because the idea is to just do light exercises to begin with, and slowly you can progress further. So how progression works is right now, like we are doing only 3 repetitions. As you feel more comfortable with these exercises, you can start doing 5, 7, 10 repetitions and like that. Okay. Now what we're going to do next is trunk rotation so that the lateral muscles, lateral side of your thoracic cage is also stretched. So you're going to keep your hands on the head, and you're going to rotate like this. You're going to rotate from your trunk, not your lower body. And while rotating, you're going to inhale. In this, we're going to hold 3 seconds at the end range. So first observe, hold it here for 3 seconds, come back, then to the other side. Try. 1, 2, 3. Back. Again. 1, 2, 3. Exhale and come back. Very good. Again. 1, 2, 3. Good. To the other side. One more time. Perfect. On the other side. Very good. Relax. Now we're almost midway through our breathing exercise. I just want you to check your O2 saturation once again and see if you're maintaining that well. This is just as a precautionary measure you should be checking during the exercises.
Yes, it's showing 90.
98. Perfect. So you're maintaining your saturation very well. Great. Okay. So now the next part, we're going to do segmental breathing. I'll explain you step by step. So this basically, there are different segments, different lobes in your lungs, and we need to make sure that every lobe, every segment of your lungs is functioning well. So first thing that we're going to do is called as apical segmental breathing. In that, what you're going to do, keep your both the hands on your, yes, like at this area, slightly down if you can. Okay, perfect. And now when you breathe in, you want to feel how the breathing is going to be from the upper part of your lungs. So try to feel the movement of your hands going up and down. Breathe in deeply. Perfect. Very good. All of you, if you can observe the movement that is happening. So this has to be focused on the upper part of your lungs. Very good. Good. Now, next is the lateral coastal segmental breathing. So what you're going to do is keep your hands just below your armpits like this. Okay. And then breathe in, and you're going to feel your hands move out. Very good. Perfect. That's it. Now, next, we're going to do diaphragmatic breathing. So diaphragm is a one of the major primary muscles of your breathing, and that is situated, which differentiates between your abdominal cavity and your thoracic cavity. It is basically situated just below your lungs and above your abdomen. And through abdominal breathing, we try to make sure that your diaphragm is working fine. So for that, I would request you to take a position on the bed, where you can just great, shift down a bit and lean back on the pillow. Perfect. Now bend both your knees. So this position is called as a semi-phallus position, which is this is the position in which your diaphragm is the most relaxed and will allow, this position will allow your diaphragm to move the maximum. So now what you're going to do is keep your one hand on the chest, slightly up, and one hand on your abdomen. Now, when you're breathing, you need to focus on your lower hand, which is on your abdomen, and watch that hand or feel that hand moving up and down, while your hand on your chest should not move at all. So breathe in deeply. Perfect. Your chest is also, you're involving your chest as well. Try to limit the involvement of the chest and focus just on your abdominal muscles. Much better. Very good. Now you're going to place your hand on the side of your, just below your rib cage, slightly above, and now try to breathe in and feel your hands move out. So we are not normally used to using your diaphragm primarily for consciously for doing the inhalation. So right now, if you see where Ajay is using his chest cavity more than his abdominal cavity, so try to work more on the hands. Your chest is still moving more than your abdomen. You're better. Okay, all right. So that's all. So these are the respiratory exercises or breathing exercises that you're going to do, which are aimed at improving the tidal volume of your lungs and overall improving the lung capacity. Now, in the next segment of our exercises, we're going to work on the muscles in the joints, because when you're in isolation or when you're in home quarantine, you tend to sit at one place or lie down at one place more, and that can affect your joints and muscles. So that's why it's important, frequent enough, at least 4 to 5 times in a day, you are moving all the joints in your body and just encouraging muscle activity overall. So first thing that I'm going to ask you to shift back a bit. Okay, all right. So far, you're feeling comfortable?
Yes.
Okay. So let's start with hand activity. So you can keep your hands in the front. Just rotate your wrist clockwise and anti-clockwise three times. Perfect. Just open your fingers and make a fist. Next is bend your elbows and make them straight. When you're doing these activities, feel the muscle movement, feel the joint movement, and do them very slow and controlled. Okay, perfect. Then you can just keep your hand on the shoulder and just rotate, and whenever you're doing all these activities, your breathing should continue normally. So keep inhaling and exhaling. Don't hold your breath. Otherwise, that might tire you out cardiovascularly. Perfect. Next is just sit to stand. For about 5 times, you're going to you're going to stand in one place and sit back down. Slowly. Down. Again. 2, 3, 4, and last 5. Sit up. Let's take a 30 seconds break. And it's important that throughout these exercises, you keep self-assessing yourself that how you're feeling. If you feel breathless, lightheaded, you feel heaviness when breathing, difficulty in breathing, you should take a break. You're feeling comfortable so far?
Yes.
Okay, great. Now we're going to do spot marching. For that, I want you to move the chair to the side and stand. Take a step back, perfect. And now spot marching. Just keep your hands at your waist level, like this. No. Just a second. So keep your hands like this. So that gives you a bit of a target. And then take your knees up to your. So now when he's doing these exercises, it allows his hips, his knees to move. Overall, his lower body is now getting mobilized, which is important. Okay, great. That's it. Now just turn to your left, rest your hands on the railing that is in front of you. And now I want you to raise both your heels up. Can you just tilt the camera down a bit so everyone can see your ankles move? Perfect, perfect. That will be great. So your calf muscles help in reverse blood supply, your venous flow to the heart. And when you're not moving enough, or when you're mostly sitting or lying down, that times activity or contractions of your calf muscles drastically go down. That's why it's important that you're doing these heel raises and making sure your calf muscles are contracting well to keep the blood circulation going fine. This is something what you can do in sitting as well. That's it. Can you sit on the chair and do the same thing? Shift the chair back a bit so it's visible. Okay, perfect. And just to add a bit of resistance, what you can do is place both your hands on your knees and try to exert a slight downward pressure. So this will allow some resistance to your calf muscles and the contractions would be even stronger. One last time. Okay, perfect. That's it. All right. So those are the exercises that you're supposed to do. And apart from that, Ajay, it's very important that you're moving around. So at least after every few hours, after every 2 to 3 hours, take a 3 to 5 minute stroll around the room. If you have open passages that you can walk in, or a straight line in the room where you can walk, just walking is also very important, and slowly you can go on increasing that time of walking. So you can start from 3 to 5 minutes, which is well tolerated by you, and your breathing is not getting affected by it, and slowly you can go on increasing that time. So all the exercises that we just did, your respiratory exercises as well as your general muscle exercises, you should be doing them 3 to 5 times in a day, and along with that a bit of walking as well.
Got it.
All right.
Thank you.
Yes, I hope this wasn't as difficult as you first anticipated it to be, right?
Yes, it wasn't. I was a little apprehensive in the beginning when you mentioned it, but it seemed to be quite easily done. And that's also maybe because, I've already completed a week
True.
post.
So the perfect time to start with these exercises is within the first, second, or third day of your infection, and that is when you should start all these exercises. Because now we still, as far as research is concerned, we are still in a nascent stage to understand what are going to be the long-term effects of COVID-19 on various systems of the body. But one thing that is coming out of from whatever researches have been done, your respiratory system is primarily affected by COVID-19, and in long-term, reduced lung capacities, pulmonary fibrosis, overall lung volumes being impacted with this is surely shown, and that's why it is very important that we should be doing these exercises since the start of your infection, and even after you test negative or all the symptoms have disappeared. For next 4 weeks you should continue with all these exercises, because as WHO has said, it takes at least 6 weeks to completely recover from COVID. 14 days is the active infection period. But after that, for next 4 weeks, you should continue with these exercises. So there are no long-term effects of COVID on your respiratory system.
Thanks.
Okay. All right. Thank you so much again, Ajay, for joining us today. And we wish you all the best, and you're going to recover fit and fine after this very soon. And do continue doing these exercises. And we hope that these exercises are going to be helpful for you, and you're going to recover pretty soon.
Dr. Saurabh, a quick question.
Yes, yes, please.
4 weeks after, you mentioned to continue these exercises for 4 weeks after the first 2 weeks of quarantine are completed. After that, then I can get back into a regular routine of exercise in terms of
Yes.
outdoor activities and.
Yes. So of course you can, and for that what you need to do is, so for any exercise that you do, progression is a very important aspect of it. So whenever you think the exercise that you're doing is not challenging enough, you need to add a bit more hold, increase the repetition of these exercises, and that way when you will keep progressing, it will be much easier when you will resume your normal outdoor activities.
Okay.
So don't just keep doing them what we have done today. Every day you should increase the difficulty of the exercises so that is challenging to your body, and that's how you're going to progress, and overall your systems are going to improve.
Right, that makes sense.
All right. Okay, thank you so much, Ajay, and thank you so much, Rajia ma'am, again for joining us today. It was very gracious of you for, even after being in quarantine, agreeing us to come live with us and helping a lot of viewers who are with us today and making them understand how simple these exercises are and how easy it is to do them.
Great, I've been happy to be of help.
Thank you so much, and thank you so much, Rajia ma'am, for joining us today.
Thank you, Saurabh. Thank you very much.
All right. And thank you, Rahul, for managing everything at the back end. It was great help, and you've made it very seamless at the back end. Over to you, Rahul. We can end the live now.
Thank you, sir. You just stop streaming from your side.